Good morning. It is Tuesday, August 17th. Welcome to the Morning Medical Update. We are simply now in a different time. Delta is different. Although our message has never wavered, our tone of serious concern has returned, and we want people to know it. Hospitals are at capacity, people are unable to get the care they need, and people have simply forgotten that COVID exists. With that, today, we are focusing on something we get a lot of questions about: the booster shots. We are joined by one immunocompromised patient. He's going to tell us what this booster shot will mean to him and his family. Plus, Dr. Joe McGurk, who works very closely with some of the most immunocompromised patients there are. He joins us to talk about who might qualify for that third shot. But first, Dr. Dana Hawkinson joins us with our numbers. Good morning.
Hi.
How are we looking?
Hi. Yeah, about the same as yesterday. We have 62 active infections, although 21 of those are in the ICU. 14 on the ventilators. We still have 23 additional patients who meet that recovered criteria, so 85 patients in total. And of those, 14 are vaccinated, so 23%. We should say those patients that are vaccinated, that are hospitalized, do have underlying conditions like solid organ transplants, some of those immunosuppressed populations, cancer, significant lung disease, heart disease, and diabetes as well. We also do have our age ranges of the patients that are in the hospital. Overall, the age range is from 19 to 99 years old, and you can see there in that graphic where the majority of those patients fall. And that would be also consistent with what Dr. Stites said yesterday about earlier on in the pandemic, our average range age of patients was in that mid-60s range, and now it's really in that mid-50s range. But again, we also have a significant number even younger than that.
Thanks for that update. Do we have reporters on the line today? Okay, I do have a couple of questions. Donna from KMBC says, she says, today there is word the FDA could recommend booster shots for the Pfizer and Moderna vaccines 8 months after the second shot. However, no word on the folks who got the J&J vaccine, what they should do. So should those people who got J&J just get the mRNA vaccines this fall, or should they wait for that approval on what's going to happen with the J&J? Dr. Hawkinson, your thoughts?
We were just talking about that, and I would hope Dr. McGurk would have the answer. Much smarter than I am. But again, we just don't. First of all, that is a very heavy loaded question because there are several questions in there. So first of all, the issue with, yes, there has been an announcement that the Biden administration may announce vaccination, additional dosing or boosters for the general population or a majority of Americans. I'm not sure what that means, if they're going by age or comorbid conditions. What exactly that means after you've gotten the first at 8 months. Again, we have not really seen the data. We do know that there is a preprint from Israel looking at people who have gotten a vaccination and looking at 4 months or out from vaccination, and certainly those people would seem to have higher maybe amounts of infection. But again, even in the conclusion for those authors, they state it really isn't enough to assess if you actually need booster or additional dosing. Again, we aren't so much worried about infection as we are hospitalization, severe disease, and death, and these vaccines still continue to do that. As far as Johnson & Johnson goes, the official wording is based on the group that looks at immunization practices, and we had Dr. Kevin Alt on here as well, but the official wording from the CDC and FDA is really there isn't enough data to assess Johnson & Johnson at this time point. So we do understand that Johnson & Johnson is a one dose. There is very little data about the Johnson & Johnson vaccine, so we are still waiting for that information. But we know that they are looking at that, and as soon as we get that, it will be, we'll relay that to you. But we also know that the CDC, FDA is looking at all that stuff as well. So the big question would be, well, if you had Johnson & Johnson, would you just get one dose of the mRNA vaccine, or would you get 2 doses? There is very little data about mixed dosing. There is much more data about mixed dosing for the AstraZeneca and the Pfizer vaccine. But again, we don't have AstraZeneca here in the United States. That data comes from England and a couple other countries in Europe. So as more data becomes available, we will let you guys know.
Dr. McGurk, I'm sure this is a question you get a lot from your patients, wondering what they're supposed to do regarding that third booster. What are you hearing?
Yes, absolutely. It's a critically important question. And Anthony Fauci and Francis Collins have suggested that in the immunocompromised population who now have an indication for that third vaccination, that it really not be considered a booster, but rather a primary attempt at protecting that patient population. The CDC guidelines that have been issued recommend that moderately to severely immunocompromised patients, for example, patients undergoing solid organ transplant, liver, kidney, lung, heart transplants, stem cell transplant patients, patients receiving therapy for blood cancers and solid tumors as well, and other populations who are on high doses of immunosuppressants, such as steroids, receive that third vaccination. Many of those patients would be expected to have no or suboptimal response to their initial vaccination. And so it's important to protect that population, but it's also important to state that these patients need to continue to social distance, wear a face mask, avoid crowded populated areas inside stores and such as much as is possible, because even with a third dose, they may not adequately form a full protective response.
Dr. Hawkinson, did you have something to add?
Yeah, and again, I think, because although Johnson & Johnson vaccinees is in quite a smaller proportion than the people who got mRNA vaccines, again, no official word and guidance, but I think, pure speculation, and we do need the data to support this. We do know that these mRNA vaccines are immensely safe, and so it would probably be safe when that happens, but again, we still need the data points and the analysis for that.
Another question from KMBC is some schools are dropping temperature checks. For one, I didn't even hear that they were doing that at my kid's school, so I assumed those were a thing of the past. How important are temp checks when it comes to flagging potential COVID cases, Dr. Hawkinson?
Yeah, I think most of us feel that those screening procedures done prior to getting into buildings or something like that really offer little benefit, and for the amount that they do detect, so many more go undetected, because we know that you can, the problem with SARS-CoV-2 is that you can spread it, and you can have a great amount of spread with no symptoms at all. So I don't think that screening and temperature check is as important in a lot of private businesses or public businesses like that, because I think the benefit you get is very, very minimal. Now, certainly for healthcare, we continue to do that. I believe that still is under CMS and regulations to do that, but for other businesses, I think that the amount of cases that you would detect would be extremely small.
Okay, I have another question from Michael over at the Kansas City Star. He says, I've heard that even some survivors of COVID patients who have died are still declining vaccination, vaccine deniers. Is this something you're hearing? And I would like to hear from both doctors. Dr. Hawkinson, is this happening? Are you hearing these stories?
I haven't heard those stories specifically. I'm sure they are out there. There are still a lot of people who believe that if you've had COVID-19, you actually don't need to get a vaccination. The recommendation is to continue to vaccinate. Why is that? Because we have actually been able to see at least an increased or more robust immune response even after getting one dose of the mRNA vaccine. Now, how does that correlate with protection? We don't have a lot of information, but at least we are seeing elevated antibody levels, and I would suspect you'd probably also have elevated T cell levels, especially if you had mild disease compared to severe disease if you were in the hospital. Dr.
McGuirk, I was up on the ICU floors yesterday, and I am hearing those stories. People who are, actually who, thank goodness they survived COVID, but now are saying they want to get the vaccine. So they had to come to the hospital, make it through COVID, and now all of a sudden they're saying, okay, I give in, I'm doing it, I'm getting it. So that's really good to hear. I always say it's like vaccinating one person at a time, no matter what happens.
Absolutely.
It's concerning, though, to hear, though, that people still going through this COVID, hospital journey, and they're still denying getting the vaccine. What are your thoughts?
Yes, well, it's deeply troubling. I'll provide a case in point. On Sunday, this past Sunday, 32-year-old nurse, 4 children at home, who developed acute leukemia a year and a half ago, almost died in the ICU, was in the ICU for a month, recovered. got her strength back, was able to undergo bone marrow transplant, is in complete remission, doing beautifully, working again. She came to me 2 weeks ago, and she had been vaccinated, had 2 vaccinations, and I asked her about her husband and her children and make sure that they were vaccinated. She said her husband did not believe in the vaccination, and he would not allow it for the children or for himself. Last week, she started developing cold symptoms. This Sunday, she came into our clinic. Our clinic is open on Sunday. We tested her, and we got a CAT scan, and she had pneumonia. I admitted her on Sunday evening for COVID pneumonia after having been vaccinated, and her husband is actually apparently quite ill. These are absolutely devastating stories. She survived a terrible acute leukemia. She almost died, spent a month in the ICU, underwent a bone marrow transplant, back to work, back with her 4 children, and now with COVID pneumonia. It's completely unacceptable, and I'll just be frank, it's irresponsible.
Thank you for sharing that story.
Yes,
wow.
I'm sorry to have to share it.
No, I'm glad you did. I think that's kind of what we're getting back to, that feeling of this is real. We have to hear the real stories and tell people, we have to tell people the way it is. So I appreciate that. And so we're going to get to your community questions, but I want to formally introduce Dr. Joe McGurk. He is the Division Director of Hematologic Malignancies and Cellular Therapeutics and the Medical Director of Blood and Marrow Transplant. So thank you so much for being here with us at the desk. I appreciate your insights. So we're going to talk more. We already have questions that came in for you yesterday, so we'll get to those just in a moment. But joining us is one of your patients, Peter Jouras. He is a bone marrow recipient. Good morning, Peter. How are you?
Fine, thank you.
Well, thank you so much. Dr. McGurk sitting right here next to us, so glad to have you both here together, patient and doctor. Peter, as an immunocompromised patient, you're vaccinated, correct?
I am, but I had no response to the vaccine.
Okay, so what are you being told? Are you going to get the booster? What's the process look like for you?
Yes, I'm going to go next week and get the booster. Yes.
So, Dr. McGurk, does that happen? A lot of these immunocompromised patients, they just have no immune response.
Very much so. We have a study at University of Kansas Hospital currently underway on 500 cancer patients, over 100 of them stem cell transplant patients like Peter, and we are measuring their response to the vaccine, several different measures, as Dr. Hawkinson mentioned, T cells and B cells, to see how they're responding. Our preliminary data that will hopefully soon be mature and we'll be able to publish suggests that a significant percentage of patients are having no response or a relatively minimal response. So it's very important that they receive this third vaccination with the hopes that they'll get a response. But again, I reiterate, such patients need to continue to social distance and wear face masks because of their vulnerability.
Yeah, they're used to doing that,
yes,
right?
That's right.
So let's talk about the qualifications for that booster, and how do these folks go about finding out if they do qualify, and how do they go about getting it?
For all of the stem cell transplant patients, solid organ transplant patients on high doses of steroids, for many of them, for all of our transplant patients and our blood cancer patients, we're contacting them directly and telling them that we need to get this done. And we're preparing for that. We're preparing for a clinic that hopefully will be formally announced in the next week, whereby they can receive it here at our center. If they're able in the interim to receive it at the local Hy-Vee or at the CVS, we encourage them to get that done promptly. So it's an active process on the part of our team. I suspect that it will be the same for the solid organ transplant recipients. Their teams, like ours, follow these patients very closely. We know who they are, and we know how to contact them. So we're messaging those patients that we need to get this done. There are other vulnerable populations as well who have, for example, autoimmune disorders, lupus, rheumatoid arthritis, and they're on high doses of steroids. Those patients are vulnerable as well and should be considered for a third vaccination.
Peter, let's find out a little bit about you. Tell us what this last year has been like for you, a little bit of your health history, and certainly going through all of this during a pandemic.
Well, this last year, I immunocompromised. I had the bone marrow transplant, cancer, all that stuff. But I have small children. I have 2 in grade school, ages 9 and 10. I have 1 in middle school, 13. We did virtual school this last year, so they are all in the basement. This year, we're sending them back to the school, but once again, the challenge is the boys are too young to get the vaccine. So fortunately, we're in Shawnee Mission, and they mandate masks. So there is some additional protection there. But it's, but I have nothing. I don't have any immunity, even though I took the vaccine. And so it'd just be a shame to get it. And really, if we all tell the truth, it's not vaccine that's the problem. It's not Delta that's the problem. It's not COVID-19 is not the problem. It's disinformation is the problem. And probably all the folks who watch your TV show are not the problem. It's all the disinformation that goes out through other venues. That's the problem. So that's all I really have to say.
Peter, I don't mean to steal your line. I'm going to be giving you total credit for this, but you said every time someone gets vaccinated, they add another day to your life with your children. I think we know what we mean by that, but just tell us why that matters, every single person that gets vaccinated, and just what that means to someone like you, a dad like you.
Well, so once you have cancer or a transplant or some serious medical thing, your days, you become very clear-minded that your days are each day is very precious. And so everybody who gets vaccinated, basically I think about that adding one day to my life. And I'm very thankful for every single person I see who gets vaccinated. And I mean, they all add one more day to my life. And every one of these days is so very precious to me because of the children. And my wife said, well, what about me? And I said, well, you're a grown woman. She goes, well, I need you too. So for my family, and it's extremely, it's really an act of, when something really terrible like this is going on, it's a crisis. You got to do something. And so I think people need to just get the vaccine or wear the mask or distance. I mean, it's all a big help.
Peter, what's it like in your house? You bring up such a good point. These kids that are under 12 years old not being able to be vaccinated. I mean, it's concerning for a healthy person, let alone someone who's immunocompromised like yourself. What has that been like? That must be a tremendous amount of stress for you. And do you do things differently in the house? Are you masking at home? What's that look like?
Well, in my house, when the children come home from school, they go up to their rooms, they disrobe, they shower immediately, and then those clothes are put to the laundry. We don't wear masks in the house currently, but I think as things progress, I'll probably become more and more isolated into a bedroom or something.
Peter, stay on the line. We're going to have some questions for you from our audience. So I want to get to our community questions this morning. We had several from yesterday, Dr. McGurk, that I wanted to just get to if we can. One of our viewers asked, is a Humira user someone who needs to get the third shot?
That's a very good question. Humira is an immunosuppressant, and I strongly encourage patients. There are a broad spectrum of immunosuppressants out there in the community, some relatively mild, some moderate, and some quite immunosuppressive, and the degree of the strength of the immunosuppressant would be correlated with the vulnerability to this virus. Mm-hmm. And so it's important that patients and their families have discussions with their primary physician about, am I in this moderate to severe immunosuppressed group whereby I should promptly get that third vaccination. Very important discussion for patients to have.
Sandy wanted to know, how long after the third shot will it be fully affected? I'm immunocompromised and hope to get the booster this week or next.
Patients promptly mount a response. The immunosuppressed population, if they're going to mount a response, you would start seeing production of antibodies within a matter of days to weeks afterwards, and durability of antibody. The challenge is that even with that third vaccination, we will still have patients who are moderately, particularly severely immunosuppressed, who are not going to respond even to that third vaccination. So again, these measures, such as Peter is taking in his home, he's not assuming that he's going to have a protective response. He still has developed a strategy whereby when the children come home, he can decrease the chance that he's going to be exposed. And I've also told him sadly, that he needs to take it easy on the hugs and kisses as well, which is hard.
Easier said than done.
Much easier said than done. And so there are so many other things that we can control in the environment for our patients and for their families to keep them safe.
That hurt my heart when you said that. That's hard to not kiss and love all over the babies.
That's
you know
right.
that. Kim had a question, and she may have missed your answer because I think you touched on it earlier about she's immunocompromised, needs that third dose. She didn't know what the recommendations are. Does she need a doctor's note, or did you say she can just walk into Hy-Vee?
She can just walk into Hy-Vee and let them know that she's immunosuppressed, and she should be able to access that vaccine.
Okay, so Dr. Hawkinson, Susan is wondering if it would be helpful if churches would hold vaccination clinics before and after services. Seems like it might be a good place to reach out for the undecided and people who are on the fence. What do you guys think?
Yeah, absolutely. I think anytime you can do outreach for mass vaccination or multi-vaccination, do it in that safe manner. But I think anytime you can further get it out to the people, I think it's going to be a good thing.
I agree. Yeah. Okay. Isaac wants to know, for transplant patients, will getting a booster run the risk of organ rejection? After all, that's the reason they're immunocompromised in the first place.
Yeah.
There are no data that suggest that would be the case, and there are really no good biological underpinnings to suggest that would be the case, even short of having data. There's certainly no expectation in our stem cell transplant population, and there should be no expectation in a likewise manner for those receiving solid organ transplants.
Yeah, and I would like to say that, Dr. McGurk's group, in addition to our solid organ transplant physicians here, were really the loudest voices, even before all of the data were out, about immunosuppressed populations not mounting those responses to get those patients additional dosing. So they, all of the solid organ transplant doctors are really wanting to get that for their patients as well.
Yes.
Nancy says, how much can our body really take of all these preservatives and things going in them? Just curious, is it too much too soon?
Well, first of all, there's no preservatives in these vaccines. There's 9 or 10 components to those vaccines that are readily available on the FDA site. And the amounts that you get of these components of the vaccines is extremely minuscule to other things that you may ingest daily, to other antigens or pathogens you may come into contact with daily if you're not washing your hands, or say if you're out working in the environment, the things that you breathe in. So really the amounts that are in these vaccines are extremely small and nothing compared to other antigens or other foreign substances which your body may encounter on a daily basis. But again, there's no preservatives, and the components are readily available on the FDA and probably even the vaccine manufacturer website.
Bobby asks, are these boosters tweaked to better cover the new variants, or just the same old dose as before?
I think we've been lucky in the fact that we know that these vaccines still are very efficient and efficacious at protecting people from that whole spectrum of COVID-19 disease, but that especially includes hospitalization, severe disease, and death. And number one, it is because of neutralizing antibodies that may or may not be in that area that kind of mutates, if you will, to help with these other variants. But it's also because of those areas on the spike protein that really don't change at all. Those are called conserved areas, and those are really what forms that the backbone of that T cell response, are those conserved areas, so that you continue to have very good responses from these current vaccines. Now we know at least Moderna was initially in some doing some experiments to pivot their mRNA to I think the South African variant, which I think is beta, but we know they are working on that. And overall, eventually I think you could put several different spike proteins in a single vaccine with the mRNA platform. However, right now the vaccines that we have still are very effective against all of the circulating variants.
Joe wants to know, would you suggest a booster for someone who has emphysema and COPD?
Yeah, as of right now, they are not in the criteria for immunosuppressed populations. But as we have heard, there's a recent news story about the Biden administration possibly advocating for additional dosing for a majority of Americans. I suspect there will be criteria there. We know that in Israel they have had a criteria of age, I think 60 and over, but I think recently they may have decreased it to 50 and over. Please correct me if I'm wrong. So I think moving forward there will be certain criteria for patients to receive additional dosing or booster dosing, and it probably will be based on age, probably other comorbidities like diabetes, like kidney disease, like lung disease and heart disease as well. We'll just have to wait and see what the full data is and then what the recommendations are.
Angela says, my mother has a common variable immune deficiency, receiving HaysMed infusions. Am I saying that correctly? Mm-hmm. Does she qualify for the booster shot?
I would be concerned about such a patient and would recommend with CVID or combined variable immunodeficiency that they be considered an immunosuppressed population, moderately to severely immunosuppressed, and that they receive that third dose.
Dr. Hawkinson, anything to add to that?
No, I think she falls under that criteria for what we have right now. Yep.
Guy asks, thoughts on Moderna vaccine being more effective against Delta?
I don't think there's any data to really suggest there's a significant improvement in effectiveness or efficacy of Moderna versus Pfizer at this point in time. So again, I would still encourage anybody, whatever they have available, please get fully vaccinated. We know that they both show great efficacy against protecting against that whole spectrum of COVID-19.
Linda asks, could a person who had acute lymphatic leukemia 30 years ago still be considered immunocompromised?
Very unlikely. Such a patient has long ago reconstituted fully their immunity.
Craig says, don't viruses usually get weaker as they mutate as far as being more deadly, even though they can become more contagious?
Mm-hmm. You know, I think this is a good evolutionary biology question or evolutionary virology question. You know, again, what we know is that the viruses that we currently live with, you know, we probably over the course of hundreds of years or thousands of years, our body in general as a population and as a human species has become to adapt to them, so it doesn't cause that significant disease. Remember that coronavirus or SARS-CoV-2 is relatively new, and so I think it's continuing on that evolutionary path. We don't know where it will end, so I think we just have to continue to stay with it. Unfortunately, we have to deal with it because it is here. The best way through it right now is vaccination, but that's a very good question, and that is just something we don't have the answer to. Where will this end? We know that these variants have adapted, or they have become more fit, or have transmission advantages. You know, why is that? Is it just because of spike? We know that for alpha, it seems to reduce our initial innate immune response by maybe reducing the interferon response, which is an early immune response. Maybe that helps it. We've seen recently that Delta, maybe there's a change in one of the cleavage sites that allows it to get into our cells earlier. So I think the bottom line is this virus continues to evolve. To which point and when does it reach its peak of the disease that it causes, the ability to transmit? We still don't know where that is, but we know that when you have more people who are infected, when you have more people who are immune suppressed who can't fight the virus, we know that that does let the ability of that virus to continue to change, adapt, to mutate for one reason or another. And so that's why it is vitally important to get everybody additional dosing, but also get those people who haven't had vaccine yet, get those people vaccinated to help reduce that overall viral replication and the emergence of other variants as well.
Dr. McGurk, is there any part of your patient population that you don't recommend the vaccine to?
There are patients who are many years out from stem cell transplant, patients such as the earlier question, 30 years out from acute leukemia therapy, and we actually study their immune systems and determine whether or not they've recovered to a normal immune system. And those patients we would not recommend unless it was recommended for the general population that they receive the third vaccine.
Stacy says, what about Dupixent for atopic dermatitis? Is that a strong immunosuppressant
I would defer that question to their general internist that is managing them. Again, there's a spectrum of immunosuppressants from relatively minimal to severe, and I can't comment on that.
Okay, thank you for that. I'm asking this question. I know we've talked about it. This is to both of our doctors, but Megan was asking about the booster, and she wants to know if the booster we got, if the one we get depends on the vaccination that we've got the first time around. Just so for people who are just now joining us, can you just tell us what you are recommending for that?
Our recommendation is that they receive the same that they received previously. If they're not able to access that, there is a caveat in the CDC recommendations that they can receive an alternative, but the preference is that they receive the same that they had previously received.
Dr. Hawkinson, anything to add to that?
No, perfect.
Perfect. Okay, Bridget, my mom is 77 and is currently receiving chemotherapy for ovarian cancer. She was fully vaccinated back in March prior to beginning her treatment. Do you have any recommendations as to the timing of her booster shot and her treatments? She receives chemo every 3 weeks.
She should receive, if the chemotherapy causes suppression of her blood counts, when the blood counts recover, oftentimes 7 to 14 days after the chemotherapy, that's the optimal time to receive the vaccination, the third dose. And such a patient receiving therapy for ovarian cancer would certainly be recommended to have that third dose. No sooner than 28 days from the second dose.
Okay, so I'm going to take a few more questions, but I want to bring Peter back in because he's so great and I love his insight. Peter, tell me a little bit about what it's been like for you just socially when it comes to this vaccine, because I know that you're very passionate about it and you just come from a different place with your health background and issues. But what has it been like for you just with neighbors and friends and colleagues and trying to express to them why it's so important that they get vaccinated? Have you had some challenges with that?
Well, I really haven't had to try to persuade anyone, but I do try to listen to folks and listen to them. And it's like, why? What are your concerns about this? Why? Just what are your concerns? And then they tell you something, and you know, my kid can't breathe when he's playing football. My kid can't, you know. He's having a hard time breathing, but then they'll say something like completely off the wall, and I'm like, well, I've never, you know, then I try to discuss that one off the wall issue, which is just disinformation. So, but I just try to listen to them, and I try not to be negative. I really try to stay really positive. I see people and I don't think anything bad about them who don't get it. I just kind of pray for them and I just hope that they come to a better understanding. Yeah, so that's about it.
Well, I think your story speaks for itself, though, too, right, Dr. McGurk?
Yes, it certainly does. And Peter is very kind and thoughtful. I'm a little bit more of a hardliner when it comes to this. And I think that there's a social responsibility. The people need to get vaccinated, not just for their own protection, but for the protection of their loved ones, and love thy neighbor, looking out for their neighbors. So Peter can go to the grocery store. Please wear a mask in the grocery store. It's really simple. And Peter has 3 children at home. If our team loses Peter to COVID pneumonia, something avoidable, it will be absolutely tragic. And that's not a rare event. We've lost 14 of our transplant patients in complete remission from COVID pneumonia so far. We presented our data in a medical journal. We published it just a couple of weeks ago. Our mortality in our patient population who get COVID is 28%. So 28% of the patients that we take care of will get this. So I really think that when we talk about their fears, Peter is absolutely right. We need to educate and get rid of this disinformation that's out there. But when we talk about self-righteousness, and I have a right not to have the vaccine, I have a more trouble with that, because we have a moral, ethical obligation to look out for our neighbors and our family and our society and our nation's integrity, which has been challenged by this pandemic.
Well said. And if you missed Dr. McGurk's story from earlier in the program, go back and listen to it. It's very powerful about your patient, your female patient, who overcame cancer and now is having to deal with COVID. So, okay, a couple more questions. Donna, people who should not receive, you talked about that one. Okay, is diabetes, Linda wants to know, is diabetes considered third booster shot eligible?
Again, that's an important question. I'm going to give that to Dr. Hawkinson, but accept a comment. Again, that a discussion with your primary physician is very important to optimize the chance that you get the best answer and recommendation.
Isaac has just a concern. Do you think that the need for this third dose booster will turn people off from getting vaccinated in the first place? Basically like, okay, well, we got 2, now we need a third, but aren't boosters common, Dr. Hawkinson? I mean...
Yeah, I mean, we have additional dosing, such as a yearly influenza vaccine. We have booster dosing for tetanus vaccine. That's every 10 years. I don't think that the people, just as Dr. McGurk has talked about, the people that are most at risk of those severe complications from COVID-19 are really going to bat an eye at this. They are going to want to do everything. We've heard from our guests, everything they can do to protect themselves. There are vaccine hesitant people, vaccine deniers, who have plenty of reasons already. I don't think this is going to be a significant reason. The main goal is to protect yourself, and just as we heard and saw from our guest, to protect the rest of the vulnerable people in the community.
And just last quick question. MJ wants to know if either of you know, do we need to show proof of chronic illness to walk into a Hy-Vee or a drugstore to get that third booster? Or they just take them at the word?
Dr. Hawkinson.
I'm not aware of the processes or systems at these private either clinics or the private pharmacies. I really do not believe you have to present anything. I think anybody can walk in and get dosing just as they would with other vaccines. But again, I don't know those because I haven't been there. But I believe anybody can really walk in anywhere. I don't know that there's a lot of tracking through the state, through the private pharmacies themselves, or certainly national as well. So I don't think they're going to be asking for medical health information if asking to get vaccinated. But again, certainly I'd stand corrected if the information is out there.
Okay, we can find out more about that too. I want to get to our final thoughts from our guests. Thank you all for being with us. Peter, thank you so much for joining us today. I just want to give you a moment to just kind of share your message and what you want folks to know.
Well, all I know is I'm very thankful to my donor. What he did, he donated the stem cells from his own body that has saved my life. It's given me an extra 2.5 years. I have a normal life expectancy now, except for I'm immunocompromised. And so what he did was a real act of humanity. I really am thankful for him. And I know Dr. McGurk and his staff, they're really supportive and inspirational. So I've been really thankful to have them as my physicians in helping me through this. So thanks, everybody. I appreciate it. You let me be on the show.
You're welcome back anytime. Thank you so much. Dr. McGurk, always great to have you here with us. Your final thoughts today.
Thank you to Peter and his family, and to our audience today, and everyone out there. Please get vaccinated for others. Please wear a mask to the grocery store. Peter needs to be around to raise those children. We can't afford to lose Peters. We can't afford to lose moms and dads, and certainly children increasingly being affected by this. It's really straightforward. Wear a mask to help others. Get a vaccination, if not for yourself, for others around you.
Thank you, Dr. Hawkinson.
Yeah, I mean, I think those messages were said best by our guests. Please get vaccinated. We know that the current vaccines still do protect against the wide spectrum of disease for COVID-19. So please get vaccinated. It will help protect you. It will help protect your loved ones and the community around you.
As we've been saying, Delta is different. Thanks for being with us today. We really appreciate your viewership. It's another episode of Open Mics with Dr. Stites. Tomorrow he is back. We have been talking about staff exhaustion and fatigue. Tomorrow we hear from 2 people in the thick of the fight against COVID. They have been at this for more than a year now. Their plea to the public to help break the surge in cases. We'll hear from them right here on this show. So that is tomorrow at 8 o'clock. And the CDC is calling for universal masking at schools, and medical communities agree, including these pediatric and pulmonary infectious disease specialists. We're going to leave you with a message from our doctors about RSV, masking, and sending your kids back to the classroom. So make it a great day, and we'll see you tomorrow.
Wait. wait. We're not going to dedensify. We got a variant that's more transmissible, and you don't want to wear a mask? Yeah, you won't be in school.
Parents here too, if the kids are bringing it home, there's a fairly high attack rate of this in the household. And so if parents, get symptoms, they need to go get tested. They're going to be off of work for 10 days.
If a child comes to school on Monday and the entire classroom is not masked, and the kid might feel fine Monday, and then Monday night not feel so well, Tuesday maybe has a fever, a little bit of a cough, and gets tested and is positive for COVID, without any of the precautions that we saw allow kids to be in school very successfully last year, now we're going to have a 14-day possibly quarantine for the entire classroom.
We have learned a lot in the last 18 months of the pandemic, and what we have really seen from our schools is that masks have really stopped in-school transmission of COVID-19.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now, everywhere podcasts are available.